So welcome to the Retirees Annual Enrollment for 2022 Benefits Info Session. We are so glad that you're able to join us. We have few team members from Employee Benefits and Aetna to talk about our ongoing annual enrollment and to share what is changing and what will stay the same in 2022. So let's do some introductions. My name is Irina Kerlak and I'm with Human Resources Communications. And we'll start with our Employee Benefits team. Kelly.
Hi, my name is Kelly Faircloth. I am the HR Officer over Benefits and Wellness, and we're very happy to have you join us this afternoon. I'll pass it over to Carrie.
Good afternoon, Carrie McManus with the Benefits team. I work with Kelly and Carla.
And I'm Carla Cook with Employee Benefits, HR Analyst. Pleasure to be here with you all today.
Thank you. And then we are going to do our Aetna team introductions. Julie.
Hi, good afternoon. My name is Julie DeHaven. I am a Senior Account Manager with Aetna, and I will be working directly with Pinellas County.
And Joe.
Hi, my name is Joe Boucher. I'm Account Director with Aetna, and I work closely with Julie and the entire Pinellas team.
Thank you. Few housekeeping items. This is a 60-minute presentation and we welcome your questions throughout. Please use a Q&A feature to ask questions. It is on your navigation bar on the bottom. You can also pose your questions anonymously if you wish. If there are any individual situation-specific questions, we will be able to address those offline. This session is being recorded, so you can share it with your family members or if you need to watch it again. And if you need closed captioning, please select CC on your navigation bar on the bottom. And thank you, and I hope you find all of this information useful. Julie?
Thank you so much. And first, I would just like to thank everybody for taking time out of their day to join this call and learn about the Aetna plan and have the time to ask your questions. So welcome, everybody. What we're going to talk about today is we'll cover why Aetna, so a little bit about Aetna. We'll talk about how the Pinellas County Retiree Plan works. This is always a big one, keeping the doctors that you know and you trust. And we will cover all the extras that come along with your Medicare Advantage plan. And as mentioned, feel free to ask your questions. We'll pepper them throughout the presentation. We want to make sure that everybody leaves here having all their questions answered and feeling comfortable with the plan. So why Aetna? So a little bit about Aetna, we have a lot of experience, over 168 years providing healthcare benefits. Almost 2.7 million members enrolled in our 4.5 out of 5-star rated Medicare Advantage plan. If you're not familiar with the STAR system, what that is that's our report card from Medicare that says how we're doing. So the more stars, the better. A lot of it is based off of feedback directly from the retirees. It's about our products. It's about our customer service and how we innovate. So we're very pleased to say that we have a 4.5 out of 5-star rating. We're dedicated to our retirees. We want to build a healthier world. Our goal is to bring simple healthcare to you, make it easy to access healthcare, and help you reach your full potential in life, whatever that looks like for you, whatever your healthcare journey might be. So you can trust us. We're here to take care of everything. We want to provide you with quality healthcare coverage. In your retirement years, it's so important that you have good benefits, and we provide benefits that go beyond those of original Medicare. We know it's super important to have the freedom to see any provider that you want to. And on this plan, you can. We'll talk more about this, but as long as a provider is eligible to receive Medicare payment, all they have to do is send Aetna the bill and we will pay that claim. We have a lot of things built into this plan to help you stay healthy, preventative services, wellness programs, and tons of resources that are available to you to help you along your healthcare journey.
Julie?
Yes.
We did have one question in regards to the individuals that are out of pocket. Again, they're asking, and you may go ahead and say this again throughout the slides, but their primary care physicians are not in the network, and do they have to pay out of pocket and seek reimbursement? So if you can reiterate on that, or if you're going to talk about that later.
Sure. I mean, I'm going to talk about it later, but let's address the question now. So it doesn't on this plan because of it's called an extended service area feature. There is really no network. So if your primary care doctor is not in the Aetna network, you can still see them, and they can send us the bill. So you don't need to pay up front. You can go see them, show them your Aetna card, and they simply have to send the bill into us, and we will pay them directly. There's no requirement for them to join our network. And we do ask that if somebody runs into a provider, which it doesn't happen very often, that is like, no, we're not going to take this plan. It's generally because they don't understand how it works. And we would like the opportunity to reach out to that provider, explain how the plan works, and then see how they feel about it. Does that help?
Yes, we have a couple of questions, but I just wanted to let them know that we will address them as the slides continue. But we did see your questions. We don't want it to be that we're ignoring them. We'll just address them as the presentation continues.
Yes.
Okay.
Most of the questions will be answered throughout the slides. So if we see something at that point, we will stop the presentation and ask your question if it's not pertaining to any of the slides that we're going to see. So we will try to answer questions as quickly as possible.
Great. Do you want me to move forward?
Yes, you can go ahead and move forward.
Okay, great. So now we're going to touch on how simply and efficiently your new Aetna plan works. So you're all on a Medicare Advantage plan now, so this shouldn't be new to you. So how this plan is going to work is super simple. At the middle of everything we do is our care advocacy programs and wellness. And then we take all your parts of Medicare and we put it into one plan. So what that means is it's one step for you. So you're going to have one ID card for medical and pharmacy. So when you go to your doctors and pharmacy, you're going to want to make sure that you show them your new Aetna card beginning January 1st of 2022, so they can update your information. But you only have that one card for all of your medical and pharmacy needs. And then you will also get a 1 monthly explanation of benefits, for one for the medical side and then one for the pharmacy, that will show you what services you've had and how it's processed. I do really want to stress to you that Medicare Advantage plans must cover all Medicare approved services. So you're certainly, you're not losing anything on this plan. We cover all things that Medicare covers. So we just did touch on this a little bit, but this is a big one. We know that, and we really do try to make it simple for you to see your doctors. So I believe I heard that folks are starting to receive their materials that we sent out, the packet that contains the plan design and the information about the plan. So with this plan, you really have freedom of access. This Aetna Medicare Advantage preferred provider organization with extended service area, the PPO ESA, what that means to you is that you have access to providers nationwide. So this plan is portable. It travels with you. You can use it while you're traveling. You can see any doctor at the same cost share who is eligible to receive Medicare payment and accept your plan. And by accept your plan, that just means send Aetna the bill. So that means that if you see a doctor that is not in our network, you're not going to pay any more to see that doctor. Your benefits are the same in network as they are out of network. There are no referrals needed on this plan, so you have direct access to care. So if you wake up in the morning and you feel like you need to go to the cardiologist, you can get up, you can make your appointment to the cardiologist, and you can go. As I mentioned, it covers you nationally while traveling. And it also provides worldwide coverage for emergency or urgent care. So let's say you're in Spain and you trip and you break your ankle. When they treat you, they're not going to recognize your Aetna card. They're going to set up another means of payment with you. But when you come back to the States, if you submit those bills to us, we're going to reimburse you what you paid out, minus any copay that you as the member may be responsible for. If you are a person that likes to know about networks, feel more comfortable knowing if your doctor is in our network, Aetna has a very robust network. We have over 935,000 network doctors and specialists, and we have over 4,000 network hospitals nationwide. So I'm going to pause there because I see the Q&A number going up. Is this a good spot to take some questions?
Yes, it is. And basically it's reiterating on individuals that may not have the doctors they're considered in network, but they may not be contracted with Aetna. Do they pay based on the negotiated rate, or do they pay what the actual bill is? I know you kind of mentioned it, but if you could expand on that.
Sure. So there's really two buckets. So the doctors that participate with Aetna that are in our network, they have a contract with us. And so we pay those doctors in our network based off of what they've negotiated with us. For the doctors who are not in our network, these are Medicare doctors. So they've agreed to take the Medicare allowable rate. And so we would pay them that allowable rate that they would get paid. And if they're one of the providers who says, well, the allowable rate isn't quite enough, and sometimes they bill that little bit of extra money, it's a 15% that they can bill, up to 15%, we also cover that. So they will get paid the same way Medicare would pay them.
And for the individual that asked the question on elaborating on any doctor at the same cost share, I'm hoping that answered your question on that one.
Hey, Julie, this is Joe. I saw a question out there about will the plan follow you from state to state? And to answer that question, yes, the plan does follow you, just as you are able to access both the 900,000+ providers in the United States, whether they're in Florida or Pennsylvania or Ohio or wherever you're at. And then I saw another question about international coverage. And the program does cover you worldwide for any emergency or urgent care needs.
And the other question is, we have retirees and they have their dependents on the plan as well. Each member that is on the Medicare Advantage plan will receive their own brochure or their packet. So if one of you have received it and the other one has not, it should be coming through the mail. The post office is a little slow at this time.
Yep, I would agree with you there. That's correct. Each person is getting their own packet. And if somebody did not receive theirs yet, they're all in the mail stream. And I know it can tend to be a little bit slow around this time and just with the overall delays. But yes, they're in the mail stream and you can expect to have them any day now.
Okay. And we will talk a little bit more about the pharmacy. There's a couple of pharmacy questions on here. So we're going to kind of leave those until we get to that pharmacy questions. And those slides, and also the rewards programs. We'll talk about a little bit more about that later on in the program. And
Carrie or Carla,
yeah,
there's one question. This is Kelly. There's one question that I would like to address at this time. I think it's a very timely question.
sure.
And the individual is saying, with the current advertising on TV about now being the time to call Medicare and tell them your zip code and get more money and more benefits, they're wanting to know if there's any reason to pay attention to that. And also, I would add that they're probably getting a lot of marketing mail as well from all over the place. So, Julie, can you address that particular scenario?
Sure. I sure can. So you don't want to pay any attention to that, because what you're seeing on TV and all the marketing that you're getting that is not co-branded with the Pinellas logo is for what we call individual Medicare products. So you're being offered benefits through your entity that you retired from, which is Pinellas County. And this is a group plan. So if you leave this coverage, you're going out on your own into the individual marketplace. So I see those commercials too. I see JJ Walker, I've seen George Foreman, I see everybody on those commercials saying to call and check your zip code. That is for people who don't get benefits through their employer, people that have to be out there and are responsible for getting their own coverage. So to Kelly's point, there's a lot of things coming in the mail right now. And one of the things that Pinellas has been really good about with us is on the materials somewhere, you're going to see the Pinellas County logo along with the Aetna logo. So anything that doesn't have that logo on it, you're just going to want to disregard because it doesn't apply to you.
And we also have a question in regards to, does Aetna outsource its prior authorization process to a third party without recourse?
So we do work with a vendor called Evacor that does handle our prior authorizations for, things like MRIs or x-rays or those types of things. So since we're talking about prior authorizations, let's stop there and talk about it. So on this particular plan, if a doctor is in our network, as part of their contract with us, they know what the requirements are to get a prior authorization. So things like inpatient hospital stay, maybe an MRI, the doctors that are in our network know what they're supposed to get prior authorization for, and the process happens seamlessly behind the scenes, and the doctor does that. For a provider who is not in our network, we don't have those requirements. It's recommended, but not required to get a prior authorization. But the biggest piece that you need to know is we hold you what we call harmless. So if a provider fails to get a prior authorization that needed to happen and a service is given, we're not going to send you a bill and make you responsible to pay that. We know that you're not responsible for that. So we don't hold you in harm and require payment from that. Any other questions to address at this moment?
There's one I'm going to address. We've got one that says to county staff, why the change in providers from UHC to Aetna? So I'll go ahead and answer that one. When we have a contract, and this is true for every contract in the county, it doesn't have to be a benefits contract, but when we have a contract that comes to its end, usually they're 5 years, sometimes they're 3 years, we are required to go out and do a competitive bid. And so that is what we did. We started preparing for our competitive bid a year or so ago. And we put out an RFP with a lot of requirements. And, companies were invited to respond to the RFP. Once the RFP response time was over, all of the competitors that sent in their bids were reviewed by a cross-functional team from across the appointing authorities, including HR, to decide, how to evaluate these different bids. We had some specific criteria like customer service and disruption and all that good stuff that we spent hours and hours and hours of time. I can tell you, I don't even want to think about how many hours it took to read all the material. We're talking hundreds and hundreds of pages. And then we had to get together and talk about it for hours. So that is the process we went through. And at the end of that process, there was some pretty clear front runners. It wasn't a very close decision. The most competitive bid, the one that offered what we were looking for, the one that we thought was going to offer the best service and benefit to our clients, which in this case would be our retirees, those are the ones that we went with. So this is a process that's required by the county. We don't just have the choice to say, okay, we're just going to renew this contract because we don't want to change. We have to do our due diligence and make sure we're looking at everything. So Aetna agreed to match our plan design. They agreed to match everything that we asked them to do. And there's some pretty cool enhancements that they've also added, which you will see later in the presentation. But I just wanted to give you the answers to why we would do this change. This may happen again in a few years because the contracts do have an end date, and at that time we're required to do our due diligence in looking for the best provider. I hope that helps answer the question. If you have more question about that, you can contact us directly in benefits, or you can go ahead and type in another question that gets a little bit more specific about what you're looking for, and we'll be glad to answer it. Thanks, Julie. Sorry about that. I see that Joe wants to answer a question live about going to another state.
Thanks. I think I accidentally hit something, but I'm happy to answer that live.
Okay.
So yes, you can, if you need to have services done outside of the state. If you live in Florida, you want to go to Georgia to have services done, you can have those done. You have the network of hospitals and doctors that you can access, and then you also have that extended service area for those providers who are licensed to accept Medicare and are willing to see you. So yes, to answer your question, yes, you can go outside of the state to have services done.
All right, thank you for that. We've got another one I'm going to let you guys answer regarding the third party. This question says, our understanding is that Evacor does not have access to our plan. They cite HIPAA and does not know what our benefits are. They will deny a prior authorization because of a Medicare guidance that does not apply to our plan, such as how many PET scans a cancer patient can receive. Can you comment on that, Julie? I'm not.
Yeah, so I can. So the thing to keep in mind is the Medicare guidelines do apply to these plans. So Medicare Advantage is a Medicare product, and we do follow Medicare guidelines. And that is true across the plan. Where you see is that we have the ability to add some enhancements. So when it comes to looking at stuff like that, we would follow Medicare guidelines.
All right. Let's see
And
here.
then
Go ahead,
regarding
Carla.
out-of-pocket maximum amount, does that mean that the combined amount from in-network and out-of-network providers?
So because this plan technically has no network, there isn't a separate column for in and out of network. There is only one out-of-pocket maximum amount, and that's $1,750. And each time you use services and you pay a copay, that rolls towards that out of pocket. So anytime you're paying, yes, that rolls to your out of pocket. And then once you hit that $1,750, then the plan pays at 100%, and you will not have any more responsibility for copays.
And I think the rest of these that we show right now are regards to prescriptions. And I'm thinking we're going to be talking about prescriptions in just a couple slides down. So we'll wait till that time.
Okay, great. All right, I'm going to go ahead and move forward then. Oops, sorry. Okay, so I just want to reiterate, yes, you can continue to see your providers if they're eligible to receive Medicare payment, which means they're a Medicare doctor, and there are 1.3 million Medicare doctors in the United States, so no shortage of providers, and willing to accept your Aetna Medicare plan, which simply means they have to submit the claim to us and we will pay them. And again, your copays are the same regardless of who you see. So before we talk about the pharmacy benefits, we are going to talk about the medical benefits. So deductible, which means the money that you would pay upfront before the plan would start paying. There is no deductible on this plan. So if you on January 1st went to go to your primary care doctor, you would simply pay your $10 copay, and that would be it. We just spoke about the out-of-pocket maximum, and that's a cap. That's a protection in place for you. So in this benefit year, you know that you're not going to pay more than $1,750 in copays for your medical expenses. Preventative care is covered 100%. So your annual routine physicals, your mammograms, your flu vaccination, all of the things that are routine, your colorectal cancer screenings, everything along those lines are covered at 100%. So you won't be responsible for any copay or cost share there. Your primary care visit, it will be a $10 copay. Any specialist would be a $15 copay. If you have an inpatient hospital stay, it's $50 per stay. So if you stay in the hospital for 3 nights, it's going to be a $50 copay. If you stay in the hospital for 10 nights, it's going to be a $50 copay. Outpatient surgery, a good example of this, colonoscopies are considered outpatient surgery. Maybe you're having a same-day knee surgery. Those will be covered, and it's a $25 copay for those types of services. And then the emergency room is a $50 copay. But if you're admitted into the hospital from the emergency room, it's waived, and then you are only responsible for the inpatient hospital copay. So I'm going to stop right there, and I'm just going to see if anybody, these are just a high level view. The packets that we sent to you have the full plan design. I want you to imagine everything that you have covered now, the services that you use are also going to be covered on the Aetna plan. This is just a high level view that we go through during the presentation, but please feel free. Are there any questions to address at this time?
Sure, there is a question in regards to a wellness gynecologist visits. Can they do that once a year?
So the gynecological exams, you can go for a routine checkup once a year, but they only do a pap smear every 2 years.
There's also, I'm sorry, go ahead, Joe.
Yeah, I just wanted to add on the second page of the summary benefits on preventive care, and this will be in the package you received. It gets in more detail. It goes into more detail of the preventive care and how often those are covered. Thank you.
Okay, and will the individuals receive a list of doctors and specialists and hospitals within their area that they can pick from that accepts Aetna?
They will not, because this is a no network plan. We don't require you to see a doctor in our network. But having said that, if you would like a provider directory, you can, once you're enrolled and you're a member in the plan, you can give a call in, and we will provide you a listing of doctors in your area that you can choose from. Or if you're a more serve yourself person, you can go online and look up doctors that are available in your area. And so those are a couple different ways. Or if you have a specific doctor you have in mind, maybe you're just looking for an endocrinologist, you can call us up and say, hey, I'm looking for an endocrinologist, and we will provide you a listing of those. But we don't proactively send out the provider directories, because you can see anybody that is a Medicare provider regardless of their network status with Aetna.
Okay.
All right, I'm going to go ahead and answer this question for county staff. The question is, since the active employees are going to be switching to Cigna, not Aetna, is this going to cause problems for HR in dealing with multiple providers and supporting retirees? Well, that one, it's a good question, but it's maybe a surprising answer. This will not affect that at all. The current UHC MAPO plan is handled by a completely different team. There's no synergy between the active team and the retiree team, none at all. They can't see the active side, and the active side can't see the retiree side. So it's like we're dealing with two different organizations anyway. So this won't cause any wrinkles for us at all. We're very used to having to deal with a completely separate team for our MAPO plan folks. So hopefully that answered the question, but let us know if you have more questions. But no, you shouldn't experience any hiccups at all. And in fact, I would say that you're going to be very, very pleased with the service that you get with Aetna. And I think we had a couple more questions that we could probably answer right now, Carla.
Yep. So there was a two-part question. I have not received the packet or ID cards yet, and the packets are coming out, and ID cards will be sent out mid-December, so you should be receiving all of those very, very soon. And we answered the rest of that question. Is there a link to an online list of doctors listed as Aetna doctors? Actually, they can log in now to Aetna and see those listings within their area, correct?
Yeah, if they just go to AetnaRetireePlans.com, you can look up providers there.
Okay. And does the out-of-pocket maximum cover the prescriptions too, or only the medical?
Only the medical.
And we have an individual that has to take a special flu vaccine because they are allergic to eggs. Is it fully covered?
If it, yes, if it, and I would imagine that it's covered now. You can't help your allergies, so I know that they have special flu vaccinations out there. But yeah, okay. Entitled to the flu vaccination 100%.
Okay. And colonoscopies, if are required by their doctor at a determined frequency, is that considered preventative?
It is not. And I just want to keep in mind too, so colonoscopies, there's a difference between a colorectal screening and a colonoscopy. So regardless of the status, usually you're entitled to, when you come onto Medicare, you get like one colonoscopy that is an exam at no cost every 10 years, I want to say. So each time you were to have a colonoscopy, you could have as many as the doctor recommended if it was necessary for a course of treatment to keep track of a health condition that was going on. You would just pay the $25 copay for those colonoscopies.
And another question is, how do we designate our primary care physician?
If you would like to have a primary care physician, you don't have to, it's not required, just to throw that out there. But if you like to have them, once you're enrolled in the plan, you can give us a call and tell us who your primary care doctor is, and we can add them and the name will show up on your ID card.
And I'm not exactly sure if this is going to be on the next slide or not, but it's asking about ambulance service.
No, but this was it as far as we had for the overview of the medical benefits. But yes, ambulance is covered, and I'm trying to look right now and see what that copay is. And I don't know, Joe, if you.
I think it's a $50 copay.
Yeah.
But yeah, it's $50 copay. Yep.
Thank you. So yes, ambulance would cover $50 copay. Thank you, team.
If an out-of-network doctor refuses to go through the process of billing Aetna.
If a doctor doesn't want to bill Aetna, we kind of go back to the conversation that we alluded to earlier in the call. We don't like for retirees to be in the middle. But if you are not interested in switching doctors, you do have the option to pay the doctor up front, and then we will reimburse you what we would have paid the provider, which is the Medicare allowable rate.
I think we can move on from here.
Okay, great. So here we go. Now we're going to talk about prescription drugs. So just a couple things about Aetna's prescription drug plan. You have access to 65,000 pharmacies nationwide. I know one of the big questions we always get, because Aetna is a CVS company, do I have to use CVS? You can use CVS, but you can use the other 64,999 pharmacies in our network as well. The only exception to that is our mail order delivery. If you like to use mail order, you'll be using the CVS Caremark mail service. Once you're a member, there are some great online tools available to track your prescriptions, to reorder, just to keep your finger on the pulse of what's going on with your prescriptions.
Question is,
Sure.
maybe we'll go ahead with the rest of this and we'll ask the questions after the pharmacy part.
Okay. So this is not new to you. You are all currently in a program that includes a Part D plan, but I thought we would just do a quick refresher. So in 2006, Medicare decided everybody needed to have prescription drug coverage. So they created what a Part D plan would look like. And then they came to the private insurance carriers and said, hey, please administer this plan for us. So the Part D plan has 4 phases. The first phase is the deductible phase, and your plan does not have a deductible. The next phase of the plan is what's called the initial coverage limit. And this is where you and Aetna are paying together. And during this period, you pay a copayment. And the initial coverage limit does have a dollar amount associated to it. And for 2022, the initial coverage limit reaches $4,430. The next phase, I'm sure you've all heard the terminology, the coverage gap or the donut hole. You do not have one. Pinellas County has filled it in, so you won't see or feel any difference. You will continue to pay the same copayment. And on the other side of the coverage gap is what is called catastrophic coverage. And this is where people who reach catastrophic coverage will pay a smaller cost share, and the plan will pick up the bulk of the cost. So we can stop here and start with the pharmacy questions if you'd like.
Okay. What is the drug program so one can look up drug costs, the formulary name, and the tier is 4?
Yep. So it is a tier 4 plan, and the formulary is an open 2+ formulary. And I would like to note that on an open formulary, that covers all Part D drugs. So any Part D drug that is out there is covered under this formulary. So if you're going to go out to the AetnaRetireePlans.com, because you can look at the formularies out there, you will look for the 4-tier open 2+. I will also say, if you're not a person that wants to go out online and look for yourself, you can call the phone number that was sent out in the announcement letter, and you can give them a list of medications, and one of our customer service members can look up your prescription drugs for you and tell you what tier they will fall on and what your copay will be for those medications.
How long will it take to transfer the current prescriptions from the United Healthcare Optum RX to the CVS Caremark?
Well, the goal is it should be done before you even come on the plan. It's in the works right now. We've already started the process to move any open refills, any mail order open refills from Optum to a CVS Caremark. If you have open refills in a brick and mortar pharmacy and a retail pharmacy, you don't have to worry about it, because those won't change or go anywhere. You just need to make sure to show your new Aetna card as of January 1st, 2022.
We will still be able to order scripts through RX to go and get home delivery of all medicine prescriptions. So you just answered that. And it asks if there will be a place on the website to see that the formulary for Aetna will be and how mail order will work. You sent us the link to the formulary, and we will have that added to our website, but it's also on your website as well, correct?
Right. Yep. It's not a link, but there's an area when you go to Aetna retiree plans. If you scroll down, it will see, look at your formulary. And so you would just select the Open 2+ for tier, and it's a PDF. When you pull it up the PDF, you can do a Control F, a find to find it. Or at the very end, medications are listed alphabetically.
Okay. Is Sam's Club a pharmacy that can be used?
It is.
Okay. And you mentioned about a transfer the prescriptions to CVS from Optum. So, and they are asking if this will be automatic with the plan change.
Yes,
So, yep.
that's the goal.
Okay, what happens if you currently use Optum RX as a mail order? So we did that. Let's see. Do we keep preferred 90-day scripts were applicable?
Yes, yeah, absolutely. And if you when you use the mail order, it's a savings. So you get that 90-day supply for a 2-month copay. So you get that benefit when you use mail order.
Okay. I currently get 2 Zolar shots per month. The first 6 copays are $35 and the next 6 copays are $117. This puts me at a catastrophic level really fast. These shots cost thousands. So there was really, I guess, if you want to kind of put a different type of question so we can answer that a little bit better for you, that would help us. And asking another question, will the formulary be the same with Aetna? Of course, it is a Medicare Part D. So we have that as well. Why is insulin a tier 3 prescription on Caremark and tier 2 on Optum?
So the only answer I have to that is each carrier with their formulary, they do things a little bit differently. So you may see that. You may find a medication where it's moved tiers. It might be in your favor and it might not be, but between carriers, there can definitely be a difference in the tierings. It's just the natural ebb and flow of things.
Okay. Is mail order cheaper than in store?
Yes.
And we're asking Publix and Costco pharmacies if they are on the list.
They are.
Could we say a little bit more about why mail order is cheaper than store?
Well, when you get that 90-day supply through the mail order, you get that 90-day for the 2 months copay.
Right. 3 months for 2 months money.
Yep. Absolutely. That's a great clear way of saying it too. 3 months for 2 months money. I like that.
Yep. We do have an individual that they're authorized to speak to United Healthcare on behalf of their spouse. Will this authorization transfer over to Aetna, or they must go through the process again?
They'll need to go through the process again. And I would actually ask if you would please give that individual my contact information so I can connect and we can start working on that.
Okay. Okay.
Julie, some of the folks haven't received their info yet.
Yep.
You know, the mail is super slow at this time. Is there a slide in the presentation that has all the phone numbers, the pertinent phone numbers on it? And if not, can we get you to give those out here? The phone numbers that were in that welcome letter? Whereas we're seeing people asking for phone numbers to call for script prices, you know, that you said they could call with their drug list. Yeah, if you could give that number here, I think that would be helpful.
Joe, I'm going to ask Joe to pull it up for me since I'm sharing my screen.
Yeah, that's fine. Yeah.
Joe, can you please pull up what the phone number is?
Yeah, it's my apologies. So 1-855-648-0388.
All right, and I typed it in to the for the answer as well. So thank you for
And
that.
we're available, Monday through Friday from 8 to 9 Eastern.
And you can call and ask them any questions. So if you are a person who's interested in knowing if your doctors are in a network, you can ask them that. They'll be able to look up your prescriptions. They'll be able to talk to you about what the copays are on the plan. Really, any questions that you have, feel free to give them a call and ask. They're waiting to receive your calls and assist you.
Do my copays for normal drugs change once the catastrophic level due to my Zolar charts for hives?
So yes, because if you're somebody who hits catastrophic coverage, what will happen is that you will pay either, it's just like it would be on the United Healthcare plan now. You're either going to pay the greater of 5% of the cost of the drug, or you would pay $9.85 copay. So whichever is greater would be what you would pay for that particular medication during the catastrophic phase.
And can you explain the information about costs for specialty pharmacy drug?
I guess I'm not sure of the question.
Okay, we'll ask them to repost that a little with a little bit more information. And is mail order shipped via USPS or other?
So it is, there are options if you need it expedited. I do believe that if you're voluntarily expediting, there is a charge associated with it. But other than that, it does come US Postal Services. And of course, there are certain medications that have requirements around cooling and heating, and we package everything based off of that. There's shipping with ice packs that do have expedited shipping because maybe it's temperature sensitive.
Okay, and that was, I think, one of the questions. What is an example of special handling drugs?
Well, it would be any that would have like a temperature. I know some medications need to be refrigerated. So for those, we obviously ship them quicker than United States Postal Service. I believe it would be UPS. And I think that you get mini ice packs, and I couldn't tell you the count of them, but they package them with the ice packs inside to keep it cool. And I believe if you want, you can set up to have to sign for those types of medications just so they're not being dropped off, schedule them when you're going to be home. So you're there to receive them and they're not sitting out in the hot Florida heat, waiting for you to pick them up.
Okay. So again, there's a couple of people that did not grasp or did not hear if is Optum transferring over to CVS. So a couple of people are still kind of questioning if that is happening. If we could just reiterate on that again, if Optum is transferring scripts over to Aetna.
Sure. So just to be clear, if you're using Optum mail order, it's not Optum that initiates the process. It's actually Aetna. And that's me who has to do that. So I've already done it. So I've initiated the process with our transition team within CVS Caremark, and those representatives work directly with Optum to send a file that transfers all of the open mail order refills from Optum to CVS Caremark. So it's in process, and those should be transitioned over to us by January 1st.
Okay. All right, let's move on.
Okay. So now we did sort of touch it. We were talking a little bit as we were going through, but just to give you a view of what the prescription drug benefit looks like, please note that the copays shown here are for a 30-day supply. So as mentioned, there is no deductible, so you don't have to pay anything up front before you start paying your copay. So the tier 1, which is the generic drugs, would be a $10 copay for a 30-day supply. The tier 2, which is preferred brand drugs, that would be a $20 copay for a 30-day supply. Tier 3 are what are considered non-preferred brand drugs, and it would be $35 for a 30-day supply. And then tier 4 is the specialty tier. And that would also be a $35 copay for a 30-day supply. As I mentioned, the coverage gap, you have full coverage in the gap. So you will always pay these copays unless you're somebody who hits catastrophic coverage. And then you will pay that 5% or a flat copay of $3.95 for generic medications, and then $9.85 for any other medication that's not generic. But that's only for folks that hit catastrophic coverage. Mail order is that 30-day supply for the 2 months pay. So you do save money by using mail order. You'll save a full copay, because if you go to a retail pharmacy to get a 90-day supply, we'll use tier 1 as example, you would pay $30 for a 90-day supply at an in-person retail pharmacy, where you would pay $20 if you got that medication through mail order. The catastrophic phase is what I mentioned, the 5% or the flat copays. And then the formulary is the open 2+. And as I mentioned, the open formulary is an indicator that all Part D drugs that are out there are a covered drug on an open formulary. And there is an additional, it's not listed here, but I would like to mention it. There is what we call a drug rider added to this plan that does cover some common non-Part D medications. So things for hair growth, anything to promote fertility, certain things for anorexia, weight loss or weight gain, some cough and cold reliefs. There's medications for erectile dysfunction. And then there are prescription vitamins and minerals, with the exception of prenatal vitamins, that are covered. And you'll be able to see those when you go out and look out on the website. So just an extra added perk that is not shown here. So I'm going to stop and see if there's any questions.
So I'm going to jump in with one, because we have somebody who's combined. We have 2 different questions here, but they're supposed to be combined. If one is traveling overseas, can one get an additional 30-day supply of a daily RX through mail order due to the possibility of disruption and being stuck outside of the U.S.? The individual does not currently do mail order drugs. Now, I'm not sure if that means the individual doesn't want to do mail order or just isn't doing it right now, but they're not asking for a 90-day supply. They're asking for a 30-day supply if they're out of the country.
They're asking for prior to leaving though?
I'm not sure, because that I'm assuming, I don't know if they mean, can they get it mailed to them from outside where they are, or if they can get it before they leave. Person asking the question, can you clarify that? We'll be able to answer it a little bit better if we understand exactly when you're talking about. If you're talking about getting it before you leave, just so you'll have it, or if you're talking about, oh, I'm out of the country and I need more of my med, can I get just 30 days? So if you could clarify that a little bit for us, that would be helpful.
And if you don't mind me asking, what country?
Yeah, that too would be fine.
And they're saying it's before they leave.
Sure. So oftentimes there is something that's called a vacation override that would allow you to get more if you know that you're going to be out of the country. But let's say, so that would mean that you would be out of the country, I'm assuming, for 4 months, because you could get the 90-day supply through mail order before you left, which would be 3 months coverage. But if you needed an additional and you knew you were going to be out, they do have things that are called vacation overrides that you can request.
Yeah, because some things they can't prescribe for 90 days. Some drugs require
True.
a restriction for only 30 days. So,
Absolutely.
so person asking the question, that's what you would want to ask if it's one of those types of drugs.
Absolutely.
Okay. Well, let's move on a little bit further on. I've just got a 4-minute mark, but we'll see if we can't move on a little bit longer from that.
Sure. So I'm just going to share this real quick, and I'm going to leave it here for a minute just so you can jot down the Social Security phone number or the website. If anybody on this call might be applicable, there is a program through the federal government that's called Low Income Subsidy. And this is what they call extra help for people that have limited income and resources. So if you call Social Security at the 1-800-772-1213 number, they can do a screening and tell you if you would qualify for the extra help, or you could go online at ssa.gov to apply online. Again, this is not an Aetna program. This is a program that is offered and funded by the federal government for those that have a low income and need some extra help paying for their medications.
So I know we're getting close to 4 o'clock, but if Joe and Julie are willing, we certainly can stay on longer, because we want to address all of your questions and make sure you have all the information that you need. So Joe and Julie, do you have time to stay on a little bit longer?
Yeah, I sure can.
Yeah.
Great, thank you.
All right, so I'm going to go ahead and I'm going to switch the slides. And now you're going to get a treat. You're going to get to move on from hearing my voice drone on, and I am going to turn it over to my colleague and friend Joe to go through all the extras that come already baked into your Medicare Advantage plan.
Thanks, Julie. Appreciate that. So I get to do the fun part with all the extras. So somebody asked earlier about, oh, it's time to call Medicare. You know, Joe Namath has encouraged you to call in, or Jimmy Walker. Yeah, let them stick to acting and football, and let the pros talk to you about, you know, all of the services that come with it. And that's the nice thing about with being connected to Pinellas, is they've worked in a lot of these services, no matter what state you're in or what zip code you're in, where the individual market plan doesn't always necessarily guarantee that. So we really emphasize your total health. We value that, whether it's physical, emotional, or social. It's all connected. You know, through COVID, you know, just not being able to hug the grandchildren, you know, has an emotional impact on you. Your emotional wellness or well-being has an impact on your physical well-being. So we've designed programs to help you, however you define, you know, your total health. We've got programs to assist. So if you want to focus in on your prevention, you know, we've got the eye and the hearing exams available to you, the annual physicals, the health reminders, the cancer screenings, the flu shots. And when it comes to wellness, and we've got some slides that will go into these services a little bit later: healthy home visits, nurse line, teledoc and telehealth, silver sneakers program, which we know is big, non-emergency transportation, and a mail home delivery service. And then if you need support for a chronic health condition, you know, diabetes or heart disease or COPD, we have clinicians that are there to help you manage those conditions better, to help you avoid a readmission after being released from a hospital. And then if you have an advanced illness, we also have the Aetna Compassionate Care Program to help you through those tough times. Now, you can expect to receive 3 phone calls from Aetna once you've joined. The first one's going to be a welcome call, just to make sure that you understand the plan and answer any questions that you have on your mind. The second one will be to fill out a health risk assessment. That is a requirement that we have through CMS. And then the third call is for a healthy home visit, which I'll get into on the next slide. Now, all these phone calls are voluntary. You don't have to take them. If you wish to do so, you know, feel free to interact when we call. Next slide, please. So the first thing we want to do is get into the healthy home visit. This is a completely voluntary program. And if you choose to participate, a nurse is going to come into your home and review your healthcare needs with you, review your medications, your health history, your family health history, and share information, if you allow us to, with your primary care physician, so that they can provide better treatment to you. Now, this isn't a way for us to manage your care. It's a way to assist your providers in giving you better care. In addition to that, the nurse will be doing a home safety assessment. You know, falls are a huge impact in a lot of people's lives. It costs you know, a lot of quality of life impact to you, and we want to try to identify the safety risk within your home. So it might be a rug that doesn't have a backer that is a fall risk. It could be a loose banister. It could be a light that is out in a back room that requires a ladder to change the light bulb, or it could be, let's say, a clogged gutter in the wintertime. Water overflows, gets on the front wall, causes an icy situation, and then you have a risk, you have a fall hazard there. What they'll do is not only they'll identify these for you. In 2 slides, I'm going to go into the Resources for Living program. They'll be able to identify the local resources that help you address those situations, like lawn care or handyman or somebody that can help fix the roof. Almost acting like when you were an active employee, you had an employee assistance program with work-life resources, very similar to the work-life resources, finding those local people that can assist you when it's something that you can't do on your own. Now, we do follow, our clinicians do follow all center CDC guidelines and safety measures, including social distancing and making sure we're wearing masks and gloves when we visit you. And we can even do a telehealth virtual provider visit if necessary. Next slide, please. Just a quick touch point on the 24-hour nurse line. Sometimes you have a question about a health concern. Should I go to the doctor? Should I go to the urgent center? We have a 24/7 service available to you. It's an 800 number that you can call to talk to a nurse to discuss your symptoms and what your treatment options may be, or your medical procedures that are available to you. As always, if you need emergency care, please call 911 or go to the nearest emergency room immediately. Next slide, please. One more. There we go. Resources for living. So I talked about the home safety assessment, identifying the risks within the home or even outside the home. And what Resources for Living does, as I'd mentioned, if you think back to when you're an active employee, you might have had an employee assistance program with work-life resources that helps connect you with, let's say, somebody to do lawn services for you or a home repair. In addition to that, maybe finding transportation from your home to a local gym that you want to go to. Even social recreational activities. It's very important. We talk about your social connectivity helps your emotional well-being, impacts your physical well-being. If you want to get more involved with the community, call us up. We'll find those social and recreational activities and tell you where they are. The program does not cost you anything. The only cost to you is if you hire the vetted people that we are vetted people or services that we're referring you to. And again, this is a voluntary services that is available to you through the Medicare Advantage program. Next slide, please. This program also comes with non-emergency transportation. It includes 24 annual rides for your non-emergency trips to and from medical appointments. It's very important that if you have an appointment to see a provider, make sure that you get there. That's why we're facilitating it with these 24 annual rides. It includes a 60-mile radius, and if you do a round trip, so if you go to the doctor, that's one trip, and then back from the doctor is another trip. So it's nice you have those 24 annual rides with a 60-mile radius. Again, voluntary program that's available under the Medicare Advantage program. Next slide. We've got the meal delivery program. So once you leave the hospital, probably the last thing that's on your mind is spend a lot of time in the kitchen. So we provide 14 delicious and highly nutritious meals delivered right to your home. We really focus in on catering to your dietary needs. This will include diabetic and pureed foods, always nutritionally balanced. These are restaurant-inspired recipes that are prepared in USDA certified facilities. We're constantly changing and evolving our menus to keep everything fresh. So again, it's important that you have those meals, so contact us to arrange for those meals once you're released from the hospital, and we'll deliver them right to your home. Next slide. This is probably one of the most widely requested programs that we have from the retiree population is the Silver Sneakers program. So with the Medicare Advantage program, you do receive a Silver Sneakers fitness benefit. This provides you access to over thousands of participating gyms and fitness centers nationwide at no additional cost. And again, as we learned through COVID, the last thing you want to do is go out and get sick. So we provide to you over 200 on-demand videos and live virtual classes that you can take from the comfort of your home. And then all of the contact numbers that you see here on these slides, they will be in your kit that you receive, and then also your welcome packet that you'll receive after you've been enrolled in the program. Next slide. So this slide and the next, we're talking about telehealth and teledoc services. And I want to kind of draw a line of delineation between the two. So telehealth services, these services are available for the most part through your local provider. So your primary care physician. Now, not all providers have it, but many do. And what it is, you're calling your primary care physician, your specialist, and you're asking if you can have a telehealth visit so that you can do a visit with your provider in the comfort of your own home using your tablet or using your smartphone. And what's nice is you don't pay. The copays are all listed in your summary of benefits. I'm looking at those right now. Your telehealth services are covered. Looks like everything is a $0 copayment for those telehealth services. Again, this provides you with a level of access without the risk of going into the doctor's office where there are a lot of sick people and puts you at risk of contracting. COVID was one of those things that really kind of popped up. Behavioral health services, that's been another one that really kind of took off because of COVID. Doing your behavioral health outpatient services in the comfort of your home using that smartphone or that tablet. Next slide. Okay, now we're going to talk about teledoc. A little different with the telehealth. Telehealth, you're most likely using your providers in your local area and if they offer it. What's nice about teledoc, and I have this even as an active employee, is access to a provider by calling an 800 number 24/7, 365, board certified doctors, typically when you're traveling away from home. So if you're considering going to the emergency room or urgent care center for a non-emergency issue, obviously for emergency care, you'll want to go to the nearest ER. But if you're considering going to the ER or the urgent care center for a non-emergency situation, call teledoc and they'll arrange a virtual visit using, again, the same thing, using the smartphone, using the tablet to review your cold or flu symptoms, your allergies, your sinus problems, and then that doctor can write you a script that you can go pick up at the local pharmacy. So teledoc, it's a service that's always there, 24/7, 365. Telehealth, you're using your local providers who may or may not have access to that virtual visit. Next slide, please. All right, so here's the website. Somebody had asked earlier about how to access information about the prescription drug program. Everything is going to go through the website. Out there, you can review your benefits and coverage. You can look at your member ID card. You can view it or print it. And that member ID card will come to you in December before January 1st. So you'll have that available to you. You want to make sure that you replace your UHC card with the Aetna card and show that to your provider on your first visit. While out there, you can also view your claims data and the status. You have your EOBs, you have that entire history out there, as well as access to the directory of doctors and hospitals and pharmacies that you can use, and all the value-added programs that I just discussed. This does require that you set up your own username and password. If you need assistance with that, please call into the customer service unit. They'll be happy to walk you through that process and get you set up. If you're the type of person that doesn't like going online and exploring all this stuff, again, we really emphasize access our customer service unit, and they will give you the services and provide you with the information that you require. One more slide. So what is next? So with the program, you will be automatically enrolled in the Aetna Medicare Advantage program. There's nothing for you to do. But if you want to opt out of the program through Pinellas County, before the 22nd of November, you need to call us at the number that we previously provided, the 855-648-0388 number, and say that you do not want to be enrolled through Pinellas. Now, if you opt out, you still have coverage under original Medicare, but you won't be able to re-enroll with the employer group plan at a later date. So again, if you want to opt out, you have to actively do that. Otherwise, you're going to automatically be enrolled in the Medicare Advantage program, and you do not need to do anything. That's, I apologize, there's one more slide, talks about the 98 level of overall satisfaction with the Aetna Medicare Advantage program. I'm proud to say my dad, he worked for the state of Pennsylvania, Commonwealth of Pennsylvania. He is covered under the Aetna Medicare Advantage program. I couldn't be happier for him. It's a great service. I think you're going to be very pleased with the level of service and benefits that you get with the program. At this point, I guess we're at the end of the presentation, the slide presentation. Do you want to open it up for some additional questions? It looks like we've got about 11 out there.
Yep. So there's a question. Is there a rewards program? United Healthcare had a Renew Rewards program.
There is no rewards program built into the Aetna program.
Okay. I have a doctor who is a non-Medicare doctor. My current provider does cover his services. Will that be available with Aetna? May need some more.
Non-Medicare doctor, my current provider does not cover his services. So this is a non-Medicare doctor. So he's one of the 7% that are not Medicare accepting doctors. They would not have coverage under this program.
I think when they say my current provider, I think they actually mean their current carrier. So
a non-Medicare doctor should not be covered by the United Healthcare plan either, because it's also a Medicare Advantage program. So that would be one of the criteria. That's really the only criteria. It's got to be a Medicare participating provider.
yeah, I think we need a little bit more detail in that question to truly answer it, or you can just give Aetna a call or give us a call.
Okay. Would we have to pay for shingle shots since we now need 2 shots?
Shingles vaccinations are covered under your Part D plan. I'm not sure what tier they are, but that would be a great question for the customer service line. But they are covered under the pharmacy portion of your plan, and it would be the newer one. You're right, with the two series. I've had that one myself, but yes, under the Part D portion of the plan.
Okay. The booklet says that most specialty drugs are not available in the mail order cost share.
That would be correct, because most specialty medications are available in a 30-day supply. If there's some that are not, it would be the exception to the rule. But typically, specialty medications are provided in 30-day supplies.
Okay. The contact number, the same for prescription mail order.
Yes, the contact number is going to be the same for all of your needs. So, and here I'm going to, if you don't mind, I'll scroll back. So this phone number that you see right here, this 855-648-0388, that's going to be your number for everything. But please keep in mind that right now, they're not going to show you in our system. So they're not going to be able to assist you with getting signed up for mail order if you're not already enrolled. So I always recommend just wait till you get your member ID card in hand, and then you have your ID number, give a call in, and you can start the process of getting everything on file if you're new to mail order, or you can call and check and see, confirm that your open mail order refills transferred, but you're going to want to wait until you have your ID card to give us a call for those types of items.
Is the formulary the same as compounded?
I'm not clear on what the question is.
Okay, if,
Joe, do you understand?
I do not understand that.
Okay.
okay, if they could, the person about the compounded, please re-ask that question for us.
So just as a summary, a formulary, just by definition, is it's a list of drugs that, and they vary from insurance plan to insurance plan, but it's a list of drugs and that they choose based on their efficacy and cost, and they try to give you a wide number of prescriptions in each particular tier, so that nobody goes without a medication to address their medical concerns. Hopefully that helps understand what a formulary is, if that's what's being asked.
And how does one get preventative services?
You
Call
just
your-
go.
Yeah, call your primary care physician if you need an annual exam, or your OBGYN, or your wherever you go for that annual, for your preventive service. Just call them up and make an appointment just as normal.
Okay. And what about prescription vitamin D?
So that could be covered under part of the rider as long as it's a prescription vitamin. I would again recommend calling the phone number that's listed right here, and they will be able to tell you if that's part of the additional rider that's on the plan.
I have an individual, they're getting 6 shots in their knee for the last 11 years. The first 9 years, the copay was $45 per shot. The last 2 years, they went up to $90 per shot. Then they get a refund for the past years after the copay was, and then they were told that they should have only paid $15 copay and there would be no refund for previous years. And that individual, if you want to get in touch with us, our office, we can assist you with that as well. And okay, dental coverage. I'll answer part of that question. If you have dental coverage currently with us through Cigna, that will continue on as before. And then as part of a medical need, do you want to elaborate on that, Joe or Julie?
Sure. So Medicare covered dental does not, it does not include things like routine or preventative care. It's really more along the lines of, let's say you had some dental damage due to a jaw injury. That would be something it would be covered under, or perhaps, you're having a heart surgery and you have an infected tooth that needs to be removed to have the surgery. It's those kinds of medical necessity dental things that would be covered under the Medicare dental, that would not include any preventative basic x-ray type services on the plan.
Okay. And is there vision coverage?
So yes, you have your routine eye exam, and you're entitled to one of those every 12 months, and that would be a $15 copay.
And we also have, on top of that, our vision plan through IMED. As long as you have our medical plan, we include our vision coverage, which also includes an annual vision, plus also your hardware or contacts. That will continue on with our IMED. And the packets list an 800-307-4830 number. And they're asking, is that the Aetna general number? And then we have the Pinellas County 855-648-0388. Which is better to use?
You want to use your Pinellas County number, and I apologize, that's my fault. And actually, I'm not even gonna lie, your Pinellas team pointed that out to us, that the information was buried in there, and that was my fault for not getting that number changed. So I apologize for the confusion. The phone number that you want to call, that is just for Pinellas County, this is your number, is the 855-648-0388. So I apologize for any confusion that may have caused.
Okay. I currently get 4 of my prescriptions for 90 days for less than $30. Am I going to have to pay $30 for each one for 90 days?
I can't really answer that question clearly without, knowing a little bit more about the medications. So with mail order, if you're getting, your generic medications for the 90-day supply, it's going to be a $20 copay. There are going to be instances where if a medication is actually less than the cost of a copay, you'll actually pay that cost because we're not going to charge you more, right? So without knowing what the medications are, I can't give you an exact answer for that.
Do we still receive a monthly breakdown of monthly services?
Yes, you will. You'll get your explanation of benefits. So you'll get one for on the medical side, and then you'll get another one separately for your pharmacy. And they will show you the services, what was billed, how much we paid, what the Medicare allowable rate is. So much like what you get right now currently, you'll continue to receive them, except they'll be from Aetna.
Tooth abscess covered under this plan. Do they need to see a dentist for prescription, or can they do teledoc?
That is a great question. I believe that you could probably do teledoc. If you had an abscess tooth and you had an infection that required an antibiotic to treat it, I would think teledoc would be perfect for that. And you could get the prescription written and put into the pharmacy.
The monthly plan premium, you should have received your annual enrollment packet with the monthly premiums. If you did not receive that, if you want to give our office a call, we will make sure that we will send you out a new packet and verify that the address we have on file is correct. And then another question is they're asking for hearing exams and hearing aids.
So yes, there your Medicare covered. So you can get a routine hearing exam that's once covered every 12 months for no cost. And then you can get a Medicare covered hearing exam, which would open up an additional hearing exam for a $15 copay. And there is a hearing aid reimbursement on this plan of $500 every 36 months. So you would pay for the hearing aid and you would send the invoice into us and we would reimburse you the $500.
Okay. We have answered almost all of the questions I think we have out there. Oh, here's another one just popped up for us. Or are ophthalmologists considered specialist physicians?
Yes, they are.
All right, folks, we'll hang out for another 3 or 4 minutes to see if any other questions pop up. We don't want to leave you hanging. So if you do have other questions, please go ahead and put them out there. And while we're waiting to see if that happens, definitely want to thank Julie and Joe for spending the afternoon with us. We got to thank you. You're very welcome. I'm glad you could make it to our info session. So we really appreciate your time, especially running long. You never know how how many questions people are going to have. Sometimes there's a lot, sometimes there's a little. So we really appreciate you guys being here. Another thank you came in. I'd like to thank all of you. This is very helpful. Thank you so much. That's what we're here for. We're really glad to hear that it helped you. We do have a question. I am my husband's healthcare I think that's surrogate. Do I need to give this Aetna this information?
Yes, we're gonna wanna connect with you. So I would ask that you give the Pinellas team, if you could give her my contact information, maybe my email.
I'm doing it right now.
Yep. And then just send me an email and we can connect. Okay.
I've been giving out your contact information willy-nilly all throughout this. So yeah, you're going to be getting some calls. Got another thank you. You're so welcome. Got a will you post this recording on Pinellas County website? We absolutely will. For people to go back if they missed something, or if they want to have a family member watch it, you will find it on the website. Irina, when do you think we'll be able to get that up?
We'll have it posted by Friday.
Awesome.
Yep. And it will be on the retiree annual enrollment page.
Perfect. And we got to thank you so much for all the great info. And I'm thrilled to have Silver Sneakers back. We're thrilled too. We are so happy that it's coming back. We know that that was something that retirees were very sad to lose. So we're very glad it will be back. Okay. Got some more thank yous coming in. You are very, very welcome. Joe, I'm not sure if you're typing in an answer, but we've got anything extra for diabetics?
My apologies. I was not on mute and I was typing frantically. So yes, in addition to the coverage that you would receive for diabetics would include all of your DME and your insulin. Really do encourage you to call into our staff, and we'll get you connected with one of our care managers to help you manage your diabetes and answer any of your questions that you have with that. I think they can offer additional solutions that go beyond your insurance coverage.
Awesome, thank you. We got another question that says any limit. I'm not really sure what that's referring to, so I would ask that person to give us a little bit more information for that question. Got another thank you.
I can cover some of that. So there is no maximum dollar amount. So there's not a cap. So, we won't stop paying if you have $1 million claim. So there's no limits in a dollar amount. There's no limit on inpatient hospitalization days. So that's good news. And for physical therapy, it's also the same. We don't have those same limits in place as long as your doctor is still prescribing physical therapy and it's being effective. You can continue. So those are all the no limits that I have off the top of my head. Maybe one of those hit the mark.
You hit it. The person responded back to say, is there a limit on physical therapy visits? So you hit it. Great job. And I am really thrilled to hear that. I think that's great. Honestly, after sitting through this session, I sort of kind of want to be on this plan. If I could just have this now. We have a thank you. Great session. You are so welcome. Okay, so we're starting to see the numbers go down. We'll hang out for a couple more minutes.
Kelly, those are my exact thoughts. I did a presentation, one of Julie and I's new group coming on board, and I went through the presentation. It was a union on Tuesday, and I thought, I really need to get into this union and retire. I mean, maybe, are you guys hiring down at Pinellas? Warmer weather?
This is a fabulous plan, I'll tell you. It really is a fantastic plan that covers so much for the retirees. Okay, we have a question. Any monthly over-the-counter benefits?
No, not on this plan.
Okay. All right. Last call for questions. You're very welcome. Thank you very much. We appreciate it. All right, I think our numbers are going down. Guys, thanks again. We really appreciate you guys being here this afternoon. I am sure that we're gonna have generated more questions, but hey, that's what we're all about, right? So people can reach out to you, they can reach out to us. We'll get their questions answered.
Go ahead and give the phone number for us again. So just in case people forget what our phone number is. So our phone number is, since we changed it recently.
I know it.
Go ahead, you go for it.
It's 727-464-3367, and we're option 1. I have that engraved on my forehead.